Alyssa, and I'm a mentor in training at the BGCL Youth Center. And this,
I'm Tessa. I'm also a mentor in training at the BGCL Center.
and Sebastian, if you'd like to introduce yourself.
I'm Sebastien David, a retired doctor from Fort McLeod.
Nice.
So, as a doctor, what do you do for a living?
Well, was a combination of general practice and surgery. So I did both of those in Fort McLeod and Glasgow.
Okay. So how did you originally get into being a doctor slash surgeon?
Well, that's a bit of a long story, but anyway, I'll try and keep it fairly short. At school, the high school had 3 streams. One was classics, Latin and Greek, and I didn't particularly want to do that. The second one was history and languages, and I wasn't very keen on that idea either. So that left the third one, which was sciences. So I moved over and did sciences. Fairly early on, I realized that I didn't like physics, and I wasn't very keen on chemistry, so that left biology. So once you're into biology, you think, well, what should I do for a living? And I thought, well, probably medicine. And then I went to university to do the pre-medical, that's anatomy, physiology, biochemistry, pathology, and was then going on to medical school. And between university and medical school, I had a bit of a break. And I went to Germany and worked in a hospital there, thinking I was going to be a porter or something of that sort. But they treated me as a full-blown medical student, allowing me to assist in the operating theatre. And my last day there, they let me take out somebody's appendix.
Wow.
With supervision, of course. So that made me decide on surgery.
Cool. So what does the day-to-day look like for this career?
Well, it would vary a bit, but basically I'd be at the hospital 8 o'clock in the morning, either to do my ward rounds and see my patients who are in the hospital, decide if anything needed changing or so on, and whether they could be discharged and what would be necessary for them afterwards. Or I might be doing surgery probably 2 or 3 days a week. And that would, in the early days, I did quite a lot of fairly big surgery. But then as the hospital system gradually shut us down, I was doing more minor surgeries, and I also doing some in Claresholm as well. So that would be the morning in those cases, and then in the afternoon I'd be in the clinic seeing patients as a GP, and of course also being on call for emergency probably twice a week, and maybe 1 in 4 weekends, something like that.
Okay, great. You mentioned a little bit, but what type of training or schooling did you need to work as a surgeon?
Well, that's probably a little different now, but I trained in England. And so first of all, that was university, as I said, the basic subjects. And then to medical school, where we attended lectures, but we also saw patients. We would do the sort of admitting for patients, writing up their notes, and then reporting to the senior doctors, assisting in operating rooms. We have it divided up, so we do 3 months medicine with one group, then 3 months surgery with one group, and then so on.
Okay.
Then after becoming a doctor, there's still a lot of training to be done, depending on what specialty you want to go into. And in England, again, at that time, you more or less arranged your own. There wasn't a lot of guidance. So you looked for advertisements to see what appropriate job you thought would take you on in your career that you wanted.
Yeah.
Cool. So how does someone get a job in the field? Kind of similar to the last two questions, but
In Canada, you do much the same in medical school, but you then have to apply for what's called matching. So if you want to be a general surgeon, for example, you apply for matches in that field. And if you're lucky, you get one. Quite a lot of people aren't lucky. At the moment, they're always short of people wanting to do general practice. And I'm afraid that's partly a fault of the training system, where the specialists tend to look down on the general practitioners and
Okay.
tend to say, you know, they should know better, or they should do this better, or whatever, or they're not following the guidelines. But that's having been on both sides of this, both as a specialist in England and then coming to Canada and doing both, I've seen both sides of it. And I know that being a general practitioner is just as hard as being a specialist. And if you do it well in a community, you earn a significant appreciation. I think that's the right word.
Yeah. Okay. Cool. Well, I guess getting into school would be a big challenge, but are there any other challenges you faced either getting into school or once you became a doctor?
No real challenges in school, I don't think, but certainly as a practicing doctor, and it doesn't really matter what profession or what part of the profession you're dealing with. I think the biggest challenge is deciding with each situation you face, is this something that I should be dealing with, or is it something I should be referring on?
Okay.
And it doesn't really matter whether you're one block from the tertiary hospital or 300 miles away in northern Manitoba, where I was for a time.
Okay.
You have to make that decision. Do I have to deal with this? And if you do have to deal with it, then you get on and do the best that you can. Okay, I can think of a couple when I was in Norway House in Manitoba. We had a 30-bed hospital there, and we served communities from half a dozen reserves around northern Manitoba. And I can think of a man coming in well, not a man. He was a 17-year-old. He was brought in by the police because he'd been attacking his family members with an axe. Now, the RCMP had him in a straitjacket.
Okay.
How do you deal with that in a northern community? You need to refer them out. Not much doubt about that one. At that time, we didn't have phones to Winnipeg. So I got on the radio, talked to the resident in the psychiatric unit in the main hospital in Winnipeg, told him about this patient, and his comment was, well, he's 17, you said. You should send him to the children's hospital. I said, no, thank you. He's on his way to you already.
Nice.
So he ended up where he should. That
Yeah.
was one. Another patient that I remember very vividly was a lady who'd been out with her husband on the trap line out from Red Sucker Lake, which was the furthest away reserve that we dealt with. She'd got sick out on the trap line. It had taken her a day and a half to get into Red Sucker Lake. They'd then had to wait to get a plane in to bring her to us. So she'd already been seriously ill for 3 days. It was obvious that she needed surgery immediately. So we went on and dealt with her abdominal surgery problem
Okay,
there and then.
great.
So, do you have any advice or tips for youth that are interested in this career?
I think if somebody's interested in medicine at all, try to get to know a doctor. Doesn't matter what specialty they're in, really, to talk about the ways you get into the profession and the good and the bad about it. And that'll vary somewhat from place to place, certainly, and time to time. So I'm quite prepared to talk about some of the frustrations of being a doctor in this day and age, but there are also lots of rewards.
Okay.
And I don't mean financial. Not the ones that matter, anyway.
What would you tell someone that's new to this career?
The main thing I think I would say to them is listen to your patients.
Okay.
And I know I've heard patients say that they went to see a doctor and he sat with his back to them working on his computer. That's no way to listen to a patient.
Mm-hmm.
And certainly in many cases, you can make your diagnosis just from listening to your patient.
Yeah.
You don't need 100 tests, x-rays, CAT scans, the whole bit of it. There are times when you need all of those, but not with every patient, and certainly not with every patient. So listening to your patient, that's absolutely number one.
Okay.
So, thank you for doing this interview for us.
You're welcome. Thank you.
Yeah. Do you have any additional things that you think anybody would want to know? Any cool stories?
Other than the axe thing, because that was actually kind of interesting and funny.
I think most of my stories wouldn't be suitable.
Okay.
Well,
And you've done your medical training anyway.
yeah. Yeah. Well, if the rest of our youth at the BGCL have any more questions, we'll find a way to get them through to you so they can get answered.
I'm happy to answer questions, yes.
Okay, perfect.
Certainly.
And for the youth at the BGCL, there are going to be more videos, more interviews posted throughout the week.
Yeah.
All right. Good.
Thank you.
All right. Bye-bye now.